And so we're going to cover some of those now. First thing, of course, you're going to do when you go into any doctor's office, you're going to go through a bunch of tests, okay? And in the traditional medical model, the first thing they're going to look at is in the blood. The main thing that they're trying to identify through analyzing the blood through different erythrocyte sedimentary rate and those types of things, ESR tests and lipid profiles and those types of things, is they're trying to find either if there's infection of some sort creating these issues, or if there's some underlying disease, cancerous changes, those types of things can be very common, and that's why we're seeking it from that information and having a blood test. X-rays, you mentioned having X-rays. In a traditional medical model, you would have X-rays taken in a supine or a laying down position, and they would look for how alignment issues are and arthritides, meaning osteoarthritis, if there's some systemic arthritic condition that would be involved, like rheumatoid, psoriatic arthritis, those types of things could be found through an X-ray. Okay. Next level up from that would be magnetic resonance imaging, MRI, CAT scans, CT scans. These types of tools allow us to get a much better understanding for soft tissue, which the discs themselves are actually soft tissue. We're actually able to see where a disc would be bulging from a herniation. This would be the gold standard diagnostic test for a true disc herniation, okay, which many people have heard of and have experienced. Bone scans, the traditional model will put that in there in some situations, but it's not very much practice, in specifically with back pain and degenerative changes. However, nerve studies are very popular these days to try to figure out what they're trying to do is find out the root level of what's causing. Terms like sciatica, restless leg syndrome, those types of things are diagnoses that are secondary to things such as degenerative disc and degenerative joint disease. We'll hear a lot about pain shooting down, down the legs or the arms, those types of things. So they'll do a nerve conduction study and try to figure out what root level is really involved, and that way we can go back and try to start to look at how we're going to treat that. In traditional medical models, the intervention choice first and foremost is through drugs or pharmacology. Primarily, the first two levels here, acetaminophen and non-steroid anti-inflammatory drugs, are the first level of intervention. Typically, a person coming into a doctor's office will be given these types of drugs for reduction of symptom, and they are going to be looking at allowing some of this inflammatory process to become more controlled through chemical intervention. And the next level of that would be to go into a narcotic, and that would be pain modification drugs, particularly like codeine, hydrocodone. These types of things are very common to see that we'll give you a battery of these anti-inflammatory things and some pain medication enough to last 2 to 3 weeks, and see how things are and come back and reevaluate in that period of time. Long-standing issues then become medicated through various ways, and that would be through antidepressants, because pain becomes very significant to affecting your life, as I'm sure Bridget would attest to. And so many things such as, Cymbalta, we'll hear a lot of, Neurontin, Vicodin, these types of things we hear a whole lot about. The people will say, why are you taking these medications? Well, the doctor said because of the nerve pain. So the pharmacology intervention is trying to change the environment in which these nerves, ligaments, and tendons are existing, and therefore the symptoms should be reduced. And that is the fundamental principle behind what these interventions are intended to do. The next step of intervention then would, I term it needles and knives. waves, because the next thing is they're either going to inject something into you or they're going to cut something out of you. Doesn't make it wrong, it is just their way of dealing with it. First, with cortisone injections, they will talk about having injections into the area of concern. Surgery would be the next step, and these have become very progressed issues. So we'll have fusion surgeries, partial discectomies where they actually remove the disc out of the body, a laminectomy where they pull the posterior portion of the vertebrae out and allow the body to do that, or they'll just fuse the whole thing together and just give up on it. And that is basically the traditional medical model. So Bridget, tell us a little bit about then what happened once you came into our office.
Well, when I came into Dr. Corbin's office, he took my history and began me on chiropractic treatments of manipulation of my spine and the electrodes on my hips, and I received gratifying results almost right away, and I stand and walk better now, and I can bend over and pick something up and go up and down stairs much better than I ever could before. It's been a real pleasant experience.
Awesome. Chiropractic worked in Bridget's specific instance because she had a long-standing thing that needed some relief, and we talked a little bit earlier about the degenerative changes happening through joints not moving. So basically what we did is through chiropractic manipulation we were able to restore motion to these things, and in a sense your body then receives a big burst of information through receptors in these joints of the spine to the brain, and the brain says, hey, it's moving again. And the reaction is the endorphin release. And so many times you get almost immediate relief of the symptom that was only being masked through the drugs and things that you were taking. And so that is why chiropractic in her situation has begun her on a road to a much better life. Absolutely.
Absolutely.
Absolutely. So essentially what we're doing in our office is we're trying to treat the cause behind what these symptoms were, instead of just trying to mask the symptoms and keeping the symptoms at arm's length. So I appreciate you taking the time to explain your story with us.
Oh, well, thank you. It's my pleasure.
Absolutely. Today we've discussed basically what degenerative joint and degenerative disc disease are. We are looking at some particular instances about how to manage that. And so we're going to take a little break. We're going to set up to do a little exercise portion that's going to be directly associated with